In this video, we can discuss about antidepressant pharmacology. So, antidepressants are the drugs which can elevate the mood in depressive illness. So, what is depressive illness or major depression? Which is characterized by symptoms like sad mood, loss of interest and pleasure, low energy, worthlessness, guilt, psychomotor retardation or agitation, change in appetite and or sleep, melancholia and suicidal thought. It may be a unipolar or bipolar disorder in which the cycles of mood swings from maniac to depression occur over the time. അപ്പോൾ ആൻറ്റിഡിപ്രസൻസ് എന്ന് പറയുന്ന ഒരു മൂഡ് എഫക്റ്റീവ് ഡിസോർഡർ, സൈക്കോസിസിലുള്ള ഒരു മൂഡ് എഫക്റ്റീവ് ഡിസോർഡർ ആണ്. അത് പേഷ്യൻ്റ് എപ്പോഴും ലോ എനർജി, ലോ ഇൻട്രസ്റ്റ്, അതുപോലെ സൂയിസൈഡൽ തോട്ടൊക്കെ വരുന്ന ഒരു ഒതുങ്ങി നിൽക്കുന്ന അല്ലെങ്കിൽ അടങ്ങി നിൽക്കുന്ന രീതിയിലുള്ള ഒരു അഫക്റ്റീവ് ഡിസോർഡറാണ്, മൂഡ് അഫക്റ്റീവ് ഡിസോർഡറാണ്. അത് ഒന്നല്ലെങ്കിൽ യൂണിപോളാർ ആയിരിക്കും, എല്ലാ സമയത്തും ഡിപ്രഷൻ മാത്രമുള്ള രീതിയിലായിരിക്കാം, അല്ലെങ്കിൽ ബൈപോളാർ ആയിരിക്കും. It will switch between mania and depression. അതാള് എലിവേറ്റഡ് ലെവലിലോട്ടും ഡിപ്രഷനിലോട്ടും അങ്ങോട്ടും ഇങ്ങോട്ടും മാറി നിൽക്കുന്ന രീതിയിലുമായിരിക്കാം. Okay. Now, what is the cause for this depression? We had discussed in another video what is the different mental illness and what are the different neurotransmitters which will affect the mental illness. And in short, we can say decreasing noradrenaline and 5-HT in brain will lead to depression. So we have two options to treat the mental illness due to the depression. Either by preventing the degradation of this neurotransmitter. നമുക്ക് ഈ ന്യൂറോ ട്രാൻസ്മിറ്റർ ബ്രെയിനിൽ വരുന്നത്, അതിൻ്റെ ബ്രെയിനിൽ അതിൻ്റെ ആക്ഷൻ കാണിച്ചു കഴിഞ്ഞാൽ സാധാരണഗതിയിൽ അത് ഡീഗ്രേഡ് ചെയ്ത് പോകും. അപ്പോൾ ആ ഡീഗ്രേഡേഷനെ പ്രിവെൻറ്റ് ചെയ്യാം. അതല്ലെങ്കിൽ ഈ ന്യൂറോ ട്രാൻസ്മിറ്ററിനെ റീഅപ്ടേക്ക് ചെയ്യുന്നത്, ബ്രെയിനിൽ നിന്ന് പുറത്തോട്ട് റീഅപ്ടേക്ക് ചെയ്യുമ്പോഴാണ് ഇതിൻ്റെ ലെവൽ സാധാരണഗതിയിൽ കുറയാറുള്ളത്. അപ്പോൾ ആ റീഅപ്ടേക്കിനെ പ്രിവെൻറ്റ് ചെയ്തു കഴിഞ്ഞാൽ നമുക്ക് ഡിപ്രഷനെ ട്രീറ്റ് ചെയ്യാൻ പറ്റും. Now let's see the classification of antidepressant. It is mainly classified into 5: reversible inhibitor of MAO-A, tricyclic antidepressant, selective serotonin reuptake inhibitors, serotonin and noradrenaline reuptake inhibitors, and antidepressants. So let's see one by one. Reversible inhibitor of MAO inhibitor, moclobamide and chlorgyline. Now tricyclic antidepressant drugs like noradrenaline and 5-HT reuptake inhibitor like imipramine, amitriptyline, triampromine, doxepin, dotiopin and clomipramine. And predominantly noradrenaline reuptake inhibitor, desipramine, nortriptyline, amoxapine and Reboxetine. Now coming to selective serotonin reuptake inhibitor, fluoxetine, fluoxamine, paroxetine, sertraline, citalopram, escitalopram and doxetine. And serotonin noradrenaline reuptake inhibitors like Venlafaxine, duloxetine, and atypical antidepressant like trazodone, mianserin, mirtazapine, bupropion, thioneptine and amineptine and atomoxetine. In this, amitriptyline is an important drug which is usually seen as an 5-mark question antidepressant, and fluoxetine. These two are important questions from this topic as a direct question of pharmacology of amitriptyline or fluoxetine. So this is the classification. Now let's see first classification, that is MAO-A inhibitor. So as I mentioned before, it is the enzyme which are required or which are required for the deamination of bioamines like adrenaline, noradrenaline, dopamine and 5-HT, monoamino oxidase. And there are two types of monooxidase enzyme, monoamino oxidase isoenzyme A, monoamino oxidase isoenzyme B. MAO-A will primarily deaminate 5-HT, 5-hydroxytryptamine and noradrenaline, and MAO-B will be preferably deaminate phenylethylamine, and it's inhibited by selegiline, and which is used in Parkinsonism. So for the treatment of depression, we will use preferably MAO-A inhibitors. So by inhibiting this enzyme, we can inhibit the deamination of 5-HT and noradrenaline. Thereby we can increase the level of 5-hydroxytryptamine and noradrenaline in the brain, so we can treat the depression. So that is the mechanism of action of MAO-A inhibitor. It will preferably inhibit the MAO-A enzyme, so it will preferably prevent the deamination of 5-HT and noradrenaline. So there will be sufficient noradrenaline and 5-HT in the brain. So we can use these MAO-A inhibitors like chlorgyline and meclobamide as an antidepressant drug. Now let's see what are the adverse drug reactions of MAO-A. Postural hypertension, blurred vision, dry mouth, and nausea and dizziness and headache and insomnia are important adverse drug reactions. Now another one adverse drug reaction as well as drug interaction is cheese reaction. So what will happen if we are using the product which are containing rich in tyramine like cheese, fish, meat, beer, wine and yeast along with the MAO inhibitors? This MAO inhibitor will inhibit the enzymes which is required for the metabolism of tyramines. So tyramine will escape the degradation in the gut and liver, so it will reach us into the systemic circulation and it will displace large quantity of noradrenaline from the sympathetic nerve endings. So what will happen? There will be an increasing BP which will lead to hypertensive crisis as well as cerebrovascular accidents. So the patient may go into hypertensive crisis and hypertensive shock. That is the cheese reaction. This is an important adverse drug reaction as well as drug interaction of MAO-A inhibitors. So by using MAO-A inhibitors, if we are administering the food like cheese, fish, yeast, beer, wine and yeast which are rich in tyramine, due to the effect of MAO inhibitors, the metabolism of tyramine is prevented. So by preventing the metabolism of tyramine, all the tyramine will reaches to the systemic circulation and it will displace large quantity of noradrenaline from sympathetic nerve ending and it will leads to increasing BP and leads to hypertensive crisis and hypertensive shock. Now other drug interactions are, it should not be used with ephedrine containing cold remedies because it will produce hypertensive crisis. Should not use with the tricyclic antidepressant reserpine, guanidine and levodopa, and anti-Parkinsonian drugs like anticholinergic will lead to hallucination, symptoms similar to the atropine poisoning occur. So these are the different drug interactions of MAO-A inhibitors. Now coming to next class of drug, that is tricyclic antidepressant. Let's see what are the mechanism of actions of tricyclic depressants. All the TCA or tricyclic antidepressant will inhibit norepinephrine transporter which will mediate the active reuptake of noradrenaline, and also it will inhibit the serotonin transporter or SERT, which is the transporter which mediates the active reuptake of 5-hydroxytryptamine or serotonin. So what will happen? By inhibiting the reuptake of these transporters, it will prevent the reuptake of 5-hydroxytryptamine as well as noradrenaline. So there will be no reduction in noradrenaline and 5-hydroxytryptamine in the brain, so there will not be any depression. So that is the mechanism of action of tricyclic antidepressant. അപ്പോൾ ഈ ഡ്രഗ് ചെയ്യുന്നത് നോറെപ്പിനെഫ്രിൻ ട്രാൻസ്പോർട്ടർ അതുപോലെ തന്നെ സെറോട്ടോണിൻ ട്രാൻസ്പോർട്ടർ എന്ന് പറയുന്ന രണ്ട് ട്രാൻസ്പോർട്ടേഴ്സിനെ ഇൻഹിബിറ്റ് ചെയ്യുക എന്നുള്ളതാണ്. അപ്പോൾ ഇങ്ങനെ ഇൻഹിബിറ്റ് ചെയ്തു കഴിഞ്ഞാൽ എന്താ സംഭവിക്കുക? ഈ ട്രാൻസ്പോർട്ടേഴ്സുകളാണ് ബ്രെയിനിലുള്ള നോറഡ്രിനാലിനെയും 5-ഹൈഡ്രോക്സിട്രിപ്റ്റമിനെയും ബ്രെയിനിന്റെ പുറത്തോട്ട് ട്രാൻസ്പോർട്ട് ചെയ്യുന്നത്. അപ്പോൾ ആ ട്രാൻസ്പോർട്ടേഷൻ ആ റീഅപ്ടേക്കിന് പ്രിവെന്റ് ചെയ്യും. അപ്പോൾ നോറഡ്രിനാലിൻ അല്ലെങ്കിൽ 5-ഹൈഡ്രോക്സിട്രിപ്റ്റമിന്റെ ലെവൽ നമ്മുടെ ബ്രെയിനിൽ കുറയില്ല, നമുക്ക് ഡിപ്രഷൻ ഉണ്ടാവില്ല. സോ ദാറ്റ് ഈസ് ദ മെക്കാനിസം ഓഫ് ആക്ഷൻ ഓഫ് ട്രൈസൈക്ലിക് ആന്റി ഡിപ്രസന്റ്. Now these are the different actions of tricyclic antidepressant. In CNS, in normal individual, there is no mood elevation or euphoria. In depressed patient, little acute effect in the initial dose, and after 2 to 3 weeks of continuous treatment, mood is gradually elevated and become more communicative and start taking interest in self and surrounding. And in autonomic nervous system, all the TCA or tricyclic antidepressant is an potent anticholinergic, so it may cause dry mouth, blurring of vision, constipation and urinary hesitancy. Now in case of cardiovascular system, it may be dangerous if we are taking in overdose, so it may produce tachycardia, postural hypertension, ECG changes and cardiac arrhythmia. And in case of tolerance and dependence, tolerance to the anticholinergic and hypotensive effect develop gradually, and tolerance towards the antidepressant action is sustained. So these are the actions of tricyclic antidepressants. Now coming to the adverse drug reactions of tricyclic antidepressants, it will produce dry mouth, bad taste, constipation, epigastric distress, urinary retention, blurred vision and palpitation. By action in the cholinergic system, it will produce anticholinergic effect due to the tricyclic antidepressants. In case of CNS, it will produce sedation, mental confusion and weakness, and it will increase appetite and weight gain, and seizure threshold is lowered, so fit may be precipitated due to the effect of tricyclic antidepressants. And in cardiovascular system, it may produce postural hypotension and cardiac arrhythmia. So due to this much of adverse drug reaction, tricyclic antidepressants are not preferred when compared with the selective serotonin reuptake inhibitor that we will discuss as next drug. Now these are some important drug interactions of tricyclic antidepressants. It may potentiate directly acting sympathomimetic amines. It will abolish the antihypertensive action of guanidine and clonidine due to alpha blocking action. And TCA may potentiate CNS depressants, and it may displace phenytoin or vinylbutazole or aspirin or chlorpromazine can displace tricyclic antidepressant from protein binding site. Phenobarbital competitively inhibit as well as induce the imipramine metabolism, and carbamazepine and other enzyme inducer may enhance the metabolism of tricyclic antidepressants. Now other drug interactions are selective serotonin inhibitors inhibit the metabolism of TCA, and anticholinergic property due to the tricyclic antidepressant, which may delay the gastric emptying and retard its own and as well as other drug absorption. So these are important drug interaction. And finally coming to the uses of tricyclic antidepressant, it is mainly used as an antidepressant, acute panic attacks, neuropathic pain, enuresis, obsessive compulsive disorder, migraine and attention deficiency hyperactive disorder. Now coming to next class of antidepressant, that is selective serotonin reuptake inhibitors. So from the word itself we can understand that these will selectively inhibit the serotonin transporters. So mechanism of action of SSRIs are It will selectively inhibit serotonin transporter or SERT or SERT, which are the important transporter which will mediate the active reuptake of biogenic amine 5-HT or 5-hydroxytryptamine into respective neurons, and thus potentiate the they will prevent the reuptake, and there is no reduction in the 5-HT in the brain, so there is no depression. So that is the mechanism of action of selective serotonin reuptake inhibitors. Now, what are the advantages of tricyclic depressants? And these SSRIs are primarily used as a first-line antidepressant drugs due to this much of advantages. These have less anti-muscarinic action, so there will not be any anticholinergic side effect like dry mouth, blurring of vision, etc. Little or no sedation, do not interfere with the cognitive as well as psychomotor function. It have fewer cardiovascular effect because it is devoid of alpha adrenergic blocking action. There is no epilepsy, there is no reduction in the threshold potential in case of epilepsy, so there is no epilepsy or seizure in case of SSRIs. There is no withdrawal or syndromes because it will not produce tolerance or dependence. There is no weight gain when compared with the TCA or tricyclic antidepressant. So these are the advantages of over the TCA. Now these are the uses of selective serotonin reuptake inhibitor. This is used as a first line drug for depression. It is used as a first line drug antidepressant. It is used for the treatment of OCD, obsessive compulsive disorder, and for the treatment of anxiety and phobias. Now coming to next class of drug, that is serotonin and noradrenaline reuptake inhibitor or SNRIs. Example is Venlafaxine. Mechanism of action, it will inhibit the uptake of both noradrenaline and 5-hydroxytryptamine but do not interact with the cholinergic receptors. Now important ADR are nausea, sweating, anxiety, dizziness, impotence and withdrawal reaction on discontinuation. So these are the serotonin and noradrenaline reuptake inhibitor Venlafaxines. Now coming to next class of drug, that is atypical antidepressant. Mechanism of action of atypical antidepressants are, it will mainly block 5-HT uptake. Also it will block alpha receptor of adrenergic and block 5-HT2 receptors. Now examples of atypical antidepressants are trazodones. These are less efficiently block 5-HT uptake, prominent alpha adrenergic blocking action and weak 5-HT2 antagonistic action. Now another atypical antidepressant drug is meancerin. It will not inhibit either noradrenaline or 5-hydroxy uptake, but it will block presynaptic alpha-2 receptor, thereby increasing release and turnover of noradrenaline in the brain, which may be responsible for the antidepressant effect. And it also have an antagonistic action on 5-HT2, 5-HT1C as well as H1 receptors. So that is the atypical antidepressant. And finally, these are the common uses of antidepressants of all the classes. It is mainly used for the endogenous or major depression, mainly by using SSRI, selective serotonin reuptake inhibitors. Also used for the treatment of obsessive and compulsive disorder as well as phobic state, mainly SSRI like fluoxetine are used, and used for the treatment of anxiety disorder, especially SSRI are used, and used for the treatment of neuropathic pain, Amitriptyline and other tricyclic antidepressants are used. And antidepressants are also used for the treatment of attention deficit hyperkinetic disorder or ADHD in children. Now, enuresis or bedwetting for the children above 5 years, imipramine 25 mg at bedtime is effective, and also used for the treatment of amitriptyline, treatment of migraine by using amitriptyline, and also used for the treatment of pruritus due to the H1 blocking action. So these are the uses of antidepressants. So that is all about antidepressant. In this we had discussed about monoamino-A inhibitors, tricyclic antidepressants, and selective serotonin reuptake inhibitors, noradrenaline and 5-hydroxy reuptake inhibitors, and finally atypical antidepressants. So hope it is clear. Thank you for watching this video.